Welcome back to Quick Hits, the podcast where we dive into the latest trends and innovations in healthcare IT. Today, we are excited to host Stephanie Davis, the Senior Analyst of Healthcare Technology and Distribution at Barclays. In this episode, we explore the ongoing challenge of interoperability in healthcare IT. Stephanie sheds light on how advancements in technology are addressing the issue, the implications for stakeholders, and the persistent barriers, such as proprietary systems, that still need to be overcome. With threats on the rise, Stephanie offers her assessment of the current cybersecurity state of healthcare IT companies and highlights the key considerations stakeholders must keep in mind when evaluating risk and opportunities in this space. Please enjoy this engaging episode as we uncover expert perspectives on the future of healthcare IT with Stephanie Davis. And don't forget to follow us on your favorite podcasting platform.
Welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by my co-host, Tyler Smith. Tyler, how are you today?
Great to be here, Ken.
Good. Yeah, we have a great conversation ahead of us. We are interviewing Stephanie. Stephanie Davis is the Senior Analyst, Healthcare Technology and Distribution at Barclays. Stephanie, welcome to the show.
Thank you so much for having me on the program.
Yeah, absolutely. We're really excited to chat with you a little bit today, especially given that you have a really interesting background. Why don't you tell us a little bit about your background? How did you get into healthcare technology?
I kind of fell into it very randomly. I started actually more on the tech side of the world. I started in tech banking. Then I was a terrible investment banker. I think I was a little bit too much on intellectual honesty. And so I decided to go into research. But because of having more of a focus on software and tech while I was in banking, I went to computer services and IT consulting, which is a terrible industry name. But it's basically a grab bag of all of the different IT services platforms that serve many different industries. It looks at fintech, it looks at payments, it looks at outsourcing, call center models. So it was everything and nothing all at once. I think I even at one point looked at the fleet card providers, the gas cards that you get if you're doing long haul trucking. After looking at all of these different industries and all these different IT platforms in them, at some point, this must have been right around meaningful use. I was at JP Morgan at the time. They realized that instead of covering a bunch of different industries and doing the IT for that, maybe they could have me look at one industry and look at the IT platforms there. And they said, you know what? If you'd consider it, you could look at just healthcare. I remember at the time thinking, how hard could it be to learn one industry? Why not? And I think I've learned how hard it is ever since.
You picked the hardest one.
I do think some of the toughest part isn't actually learning healthcare, right? They're difficult end markets. They're very nuanced, but the buying patterns are pretty static, right? The rate of change is, let's call it a leisurely walk, right? Hospitals are always going to be a little bit more backwards facing. Payers are going to be more innovation facing, but they always focus on the bottom line. Pharma is going to have deep pockets, but they're maybe a little more sophisticated buyer. They exercise more caution given their risk profile. I mean, that's been the case for over a decade now. I don't know when that changes.
Do you think technology will help drive that change?
I think you have to see more tech adoption, but I think the tech adoption that you will see, it's probably going to continue moving at a glacial pace given the risk profile that a lot of the healthcare industry has. I think what folks forget, it's like, oh, well, what is payments? That's a good example. Why does payments adopt technology so much faster? That's because if you have a breach in your credit card, you can change that data. You don't have to have a static number. Your healthcare information doesn't really have the ability to do that.
So I guess one of the other challenges that we've seen in the healthcare industry is with interoperability. I think you would agree that is still a significant challenge. What advancements have you seen so far that you think are encouraging, and what are you thinking will push that even further?
Can I answer that with a rant?
Absolutely. That's what we're here for.
One of the biggest shortcomings I think that as an industry we have, healthcare technology is that we build all these customized systems ourselves, right? Everyone has their own instance of tech, and no health tech company, let's be honest, is ever going to scale to be able to have the level of investments that a big tech player is going to have. It's just not going to exist. And so instead, we have to go through this continuous battle of, well, we built this customized technology. And of course, now this customized technology doesn't speak to the other customized technology that we built. What a surprise. And know what would really help interoperability if we just stopped having the ego to do that, took a step back, and like every other vertical software industry said, hey, let's just use what exists. Let's take the core base systems and then build some customizations on top of it. Like, look at the most successful health tech company out there, Viva. Viva didn't build their own CRM. They took an instance of Salesforce. Why would they have to go and build their own? They just build a customized platform. Only now are they saying, well, let's go get our own customized version because we've scaled and we're the dominant industry player, and maybe we want to have a little bit more of our own control of our technology. That was many years after their founding. And so I wonder if that's the big limitation to interoperability. Now, Randover, I do think advances in natural language processing and Gen AI, both of those should help unlock a lot of their data. I think the issue also with healthcare data is patients are unique, right? So you can't just say, oh, let me have a generalized code for each of these instances. There's a lot of writing that goes into it. And that writing means you have a lack of harmonization. And so the more we can have some NLP applied to that, the more you can create at least some backward standardization that can get this into a better spot. Or an LLM that can at least digest it, right?
Just going back to your rant for a minute, though, what's the fear of adopting a pre-existing system? Is it about just controlling data? Because you kind of called it hubris or ego, but is it that, or is it more just that fear of not having access to your data and controlling your data, your patient data, whether it's for research?
I think that's a very fair point, right? Control of data does come out quite a bit. I just think you also have the risk of having control of your data, if that makes sense. Look at all the cybersecurity incidents that we're seeing. I don't think having control of our data is worth having the risk of having a breach. Like, I would trust Microsoft a heck of a lot more in order to have very strong cybersecurity incidents than maybe I would trust something like even a United.
It's funny because that actually kind of goes to my next question, or our next question was, and maybe I already know the answer from the way you positioned it, but if cybersecurity threats are a growing concern across this industry, and maybe outside of just going to big tech, how do you assess the cybersecurity posture of healthcare IT companies, and what factors do you advise stakeholders when they evaluate the risk and opportunities?
I have some really bad advice there. I think you need to accept that there's going to be breaches. I don't think there's a way to fix our industry fast enough to avoid that. If you look at a lot of health tech companies, especially ones of scale, ones where it might make sense for a cybersecurity breach, if you even look at the end markets, right? Accenture's a great example. They're roll ups. A lot of this industry is roll ups. A bunch of interesting technology comes together, and then you have this one broader platform. And that makes sense for a buying motion because it's tough to buy from a bunch of different vendors, especially if you're focused on things like saving lives, as opposed to maybe a more narrow focus for most enterprises. But because of that, you have so many exposed vectors to security risk. This is not the right term, but I always like to think of it in this way. If you think about the surface area that can be penetrated with a cybersecurity incident or a virus, if you will, I think of it in the healthcare side of things, it's a really broad surface area. And so absent speed integration, which probably would leave a lot of surface area still in order to have cybersecurity threats, I think what we need to invest in more is finding a way to get these platforms back online.
So you're saying invest more in the how do you recover?
Because the big issue would change. Think about that. The issue wasn't just that it went under. The issue is that not all of Change's systems are back online yet.
Can you give us a little bit more background?
So in February, it changed to the cybersecurity incident. And if you're not as familiar with that business, that's inside of United Healthcare. But they are the main clearinghouse for, I think, a third of records in the United States. And so they're a middleman. They help all the transactions that go in between your provider and your payer. It's how healthcare gets paid. It's how you get approval for your claims. It's kind of a very core fundamental part of how we exercise healthcare. And those systems, while mostly up, there are still components of the system that aren't fully online again. It's July.
Mm-hmm. Wow.
Yeah. It's crazy because I remember, I think, Stephanie, watching you speak at Vive, and it was when Change News had just been announced. It's interesting too because another approach I've heard. So basically, what you're saying is the defensive might be futile. It's be ready to rebuild ASAP. It's almost like the beach is always eroding on the Atlantic side, and so the Army Corps just needs to be ready to keep rebuilding it. But there's also the how do we protect, or how do we do some other downside risk, which means more cyber security insurance is another
Mm-hmm.
thesis I've heard posed. So I'm wondering how you think about that. Do systems then just get ready to rebuild and also just increase their premiums with the hope that they can solve it with money and some ingenuity when it inevitably happens?
Let's say something happens to your core, you'll at least have another backup so you can at least keep some core structure running, if not the entirety of the platform.
I'm glad we're having this discussion because it affects not just healthcare, right? And Stephanie, since you're familiar with all those other industries, are you guys familiar with the CDK?
Of course, that was one of the first names I covered as a senior analyst.
Is it really? Okay, there you go.
Very, very familiar. I actually heard that. I heard that and I thought, oh my gosh, cybersecurity incidents are just following me all around. Look at that.
Yeah. So just the extreme cost and all of the employers that are affected, and then when you get into healthcare and just think of the domino effect that has, I guess it to your point, it makes sense, except the fact that there are going to be breaches, except the fact that there are going to be security events. Invest in the recovery and make sure that you can recover as quickly as possible.
Right. I don't think it's the answer people want to hear, but I talk to investors all the time and they say, how are you thinking about cybersecurity incidents, right? You had Change and you had Extension and even Frisia, not a very large company, but one that still had a cybersecurity incident.
Yeah.
And I just tell them, well, one day we're probably going to wake up and have some pretty bad days. Yeah, I accepted that. I suggest you do too.
It makes sense. Well, with the increasing adoption of EHR and telemedicine platforms, then do you think that there needs to be more regulatory changes just to kind of align with your philosophy on cybersecurity threats, or are those two always going to go in separate directions?
Well, let me ask you this. Have you ever seen a regulatory change in healthcare that was forward looking and meaningfully helped the industry?
Look, we try to be neutral here on. No, that's a good point. Yeah, that's a fair point.
Just the time it takes to create regulation versus the time that has passed between each of these cybersecurity incidents, I think you can see a pretty big delta.
Hmm.
And yeah, there's absolutely a place for regulation and maybe it can help guide some folks. But I think a lot of, industry bodies, like I think about, how Gen AI is being adopted so quickly, probably faster than anything we've seen before. And you've already seen bodies like Chai that are looking at standardization of these processes and, the best way to build them. That's probably the best way in order to make sure we have some de facto regulation, right? Having all the stakeholders get together and make sure they're working in tandem for a single vision.
And on that point around AI, and I know Ken brought this up in an earlier question, it does seem like it's being posited as the game changer for healthcare organizations. It also can streamline processes, improves patient care through examples that we've seen. Although I think most AI companies are want to show how it's not replacing a caregiver, it's augmenting a caregiver. But I guess since you get to see so many companies and you get to see the entire span of the industry, how do you see companies best addressing the growing demand for AI driven automation? And what are the key factors that you've seen where it's really been successful in implementation?
I mean, it'd be impossible to talk about this without talking about nuance. I think they have done such a phenomenal job in an area of medicine that every doctor hated, right? The note taking component. Gosh, I haven't heard a single doctor that's been enthusiastic about electronic health records simply because of that note taking. And so I think about very successful Gen AI almost the same way I think about very successful payments. I think Uber is the most successful payments construct
Hmm.
because you don't know you're paying when you're leaving the car. It's a seamless transaction. You shouldn't have doctors looking at Gen AI as, oh, I'm gonna work this LLM into my practice. It should just take a process that they already hate, such as note taking, and just get rid of it. Just not have it be a part of the process. And so I think that's probably the best component of it. But just as much as doctors don't like the note taking, I do think there's a lot of other areas of medicine that need to be improved with LLMs. I think about the call center work,
Hmm.
right? Have you tried calling your hospital lately? Have you like really had the misfortune of doing that? Whenever you go to this main routing center, there's this person with a switchboard.
Hmm.
Hey, I'm looking to reach this department, this nurse. Oh, okay, let me forward your call. You get forwarded 4 times. There's probably a lot of automation that can happen there. I also think about the back end call center work, a lot of billings. How much education do you need in order to just go and relay that in a digestible way to the patient and the consumer? I think that can do a lot in order to get it moving a little bit more forward. I will say, and this is so keep in mind, I'm a futurist, and some of these ideas maybe are a little bit crazy. But I do think there's not enough doctors, especially PCPs in the US. So while most Gen AI applications today are all around how can we reduce the friction in doctors' everyday processes, I wonder if ultimately it has to go and make the leap from admin work into clinical work. And that's not to say it replaces doctors, right? But think about it this way. We gave doctors telemedicine. We said, excellent. Now you can be more efficient. And like,
Hmm.
yes, Zoom has made me more efficient when I'm talking to clients, but all it means is I'm even more burnt out by the end of the day because before I had to walk to meetings. And now I can do back to back calls and I don't need a water break, right?
Gosh, yeah, yeah.
And I don't think that's a wonderful way to practice medicine because, we can have me do that and maybe I'm a little more crispy by the end of the day with my stock pitches. But you don't want the person who's helping make medical decisions being that crispy.
Right.
Right. Just
Right.
completely burned out. Yeah, no, that makes sense. So we made them more efficient, but we've
We keep forgetting that they're human. And you know what? Maybe the solution is to give them an assistant that isn't human.
If you're enjoying this episode of Quick Hits so far, don't forget to like, subscribe, and share. Now back to the episode. Yeah, so Stephanie, Nuance DAX, we've helped with some projects there and then a bridge. So really, really with you on ambient being a core AI technology that we're seeing adoption and can really ideally help improve care and hopefully improve providers uh, just general well-being. Now, now we're getting a lot more data, and I also loved actually going back. You were talking about the different ways you look at the industry, providers backward facing, or maybe a little bit more resistant to change, payers for change, but then it's bottom line when it comes down to it, and then pharma having these deep pockets, and then I think we talked a little about meaningful use was like your entry point, or you came in around meaningful use, which I think is when I came in. Ken might have been in the industry a little bit before meaningful use. I might say that was a regulatory change that did push something forward in healthcare.
Hey, we're all here on this call because of it, right?
Yeah,
yeah,
exactly. So
absolutely.
and I think that right now it's like you look at that adoption cycle, and there was no data that you could run. You could even be worried about what do you do with all this data because it was all in paper. And like even once we started collecting it, it was much more kind of rote and not very rich because like kind of your point, like no one wanted to be typing, and so there was a lot of smart phrases like repeating data, it wasn't really, that rich. But now it's like with conversation, it's going to become very rich. And so it seems like data lakes and data lake houses are something Ken and I have been hearing a lot more about, in our work, but also on this podcast. Shafiq Robb from Tufts talked about them. Ron Carson from Nebraska. And so it really sounds like, leaders are talking about them more and trying to figure out more efficient ways to manage all this data and analyze this data. So we'd love to hear, the commercial trends you're observing in the space and why you think some enterprises are succeeding in implementing these data management strategies and why others may be facing challenges.
Well, to bring this back to my rant,
Always.
I actually think some of the largest players in the space where I've seen them really succeed is just outsourcing it. And I'm seeing a greater trend, seeing some of my smaller companies look at this and say, you know what, I don't really need to own my data lake. This is something I could probably have done by a much larger tech company in a much better fashion. I remember the earliest days of Cerner Healthy Intent. Do you guys remember that?
Mm-hmm.
And when I would talk to them about what they're doing with their data and how they're harmonizing, they're like, the dark secret is this is mostly a manual labor job right now. We have just rooms of data scientists trying to find some way to standardize the data, and then we find some place where we can store it. And it's a lot more data than we were expecting. And I think the larger they got, the more they said, let's outsource that to big tech. And that was probably one of the best things they could have done for the industry. I think it's really blazed a trail for a lot of other folks to say, why are we doing this in-house? That's crazy. I think the biggest question now is if you have your data in disparate sources from being a roll-up, or if you maybe never really thought about creating it in this way, how do you make sure it all comes together? And so we may need a digestion period in healthcare technology. If probably the last, let's call it 5 years, was this dead sprint of, oh my gosh, we're relevant. Everyone, check this out. Health tech. It might be we might have to go and digest now and say, like, no, let's look inside. Let's make sure the house is cleaned up so we can build a better solution for tomorrow. Otherwise, get disrupted by a better solution that's being built without these barriers.
Sure. It's interesting too. You bring up digital health, and I think all of us here, we were around before it was popular.
Right. I mean, digital
And
health is just healthcare IT wearing Dior, right?
yeah,
Dressed up.
yeah. Yeah, I was gonna ask you. So yeah, for us, we were there when it wasn't cool, and then it became interesting, and then I feel like COVID made it everybody was interested, and then became cool.
Right.
Stephanie, where are we now? Is digital health still cool, or are we back to where we were pre-pandemic? Are we a little bit up? I would just love to hear your take on what the general vibe is.
General vibe. Well, from the investment community, it's tough, right? A lot of these stocks
Yeah.
haven't worked. I would say, if you had the levels of coolness be healthcare IT versus health tech versus digital health, we're not back to healthcare IT, but we're approaching it. We're
Okay.
still on the healthcare technology side, but
Yep.
digital health, we don't know her.
Mm-hmm. Yeah, no, that's fair. That's fair.
So, obviously one of the things we're always excited to talk about is AI. When it comes to automation, what's a new tool or process that you're excited about? And then the second half of that question will be, what's something that you are hoping, or what's something you're seeing like on the horizon that we're just not there yet, but that you're excited when it comes to automation with AI?
You know what really excited me? So we have this big healthcare conference, the Barclays Global Healthcare Conference, and it's every March. It gets all of the different end markets within healthcare together. We have payers, providers, health tech companies, pharma, you name it. And this past year, I also had Microsoft on the stage, which got me extremely excited because I don't know if Nuance could have become Nuance without having a very heavy lift from their Microsoft partnership. Microsoft provided a lot of the technology platform. They provided some of the AI talent, right? It's incredibly difficult for health tech to compete, not just because of our innovation, but because of our ability to pay for that innovation and hire those engineers that probably are in demand at much sexier companies. right? Especially now that we're no longer digital health. But I talked to Microsoft and they told me how excited they were about healthcare and all the opportunities that they saw in healthcare and how they were having a partnership strategy. Well, they acquire Nuance in the future, they want to partner with a bunch of different health tech names and see if they can have not just one use case, but 50 plus use cases across the board in healthcare. I see that and I think, my gosh, like if I could think of one big healthcare company that is a sleeper, Microsoft might be it if that's the strategy they execute on.
I love that mindset, and I feel like ever since I got into healthcare, I've been like surprised at okay, well, we can look to other industries and sort of guess what's coming in next. So maybe building on Ken's question, what's the next innovation that's going to leap from consumer or enterprise tech or some other industry into healthcare? If you were to guess.
Ooh. And can we not say Gen AI? Because that's the most obvious one,
Well,
right?
so we could say Gen AI, but maybe for the sake of making it more interesting, let's remove Gen AI.
Hmm. I think marketplace models. When I think about what I use every day as a consumer, a lot of it's marketplaces. Amazon is a great example of that.
Mm-hmm.
And we have all of these digital health tools, and they're all separate. Isn't that crazy? I do wonder, especially if you are an employer and you have to buy some of these solutions and you are in your 15th negotiation as you renew your contract, if you're wondering why there's no Amazon of that. They're doing a little bit of the marketplace model, but more consumer facing, less employer facing. And I do wonder why we don't have something like that today.
Yeah.
That just makes it so much more streamlined. Oh, everything in health tech, we always try to make it unique in our own. Just take some examples from broader technology and consumer usage. But that's the risk. They have One Medical now, right? They have Amazon Pharmacy.
Mm-hmm.
It's either we develop something that's so specialized in house, the Viva model. Either we carve out our niche and we dominate it, or I think we'll see a lot of the large tech players look at that niche and say, "Hey, it's pretty attractive. Maybe I'll get into healthcare."
Do you think we'll lose something to that? Do you think that something gets lost when the big players get involved? Or, I mean, there has to be a downside, right? Realistically speaking.
Realistically speaking, there always is a downside. I don't know if the downside outweighs the upside though of like
Oh,
the broader enablement,
okay.
the tech enablement of healthcare. I mean, I think the downside is that if you're a large tech company or even, a large consumer company, Walmart is a great example of this.
Mm-hmm.
It's not that difficult to say, "Hey, we've invested a ton of money, but you know what? It's not working. Shut it down." Look at Walmart's their healthcare ventures.
Yeah.
You would never see that in the health tech side of the world just because there'd be a narrow focus. So it's not like you can shut your main business model down. But I think a lot of these companies have gone to primary care where their main focus is in healthcare has woken up and said, wow, primary care is A, very difficult, and V, very expensive.
Mm-hmm.
Who knew it wasn't a profitable industry? And so they're starting to exit it, but that can create these care deserts, or that can create issues for folks that were maybe accessing care through a larger vendor.
Nice.
And so I think that's where we need to be cautious.
Mm. Well, Stephanie, this was a great conversation. We really appreciate you taking the time to talk with Tyler and I.
I'm so flattered to be on the program. You guys are doing great stuff. Oh my gosh, I listen to it all the
Oh,
time.
excellent.
So
Well, thank you.
when I got the inbound, I thought, wow, they must think I'm way more important
You've
than I am.
arrived. No, no, that's awesome. Thank you so much for the compliment. No, we enjoy doing it, and it's just great getting to talk to industry leaders like yourself who are knowledgeable. And I'm always learning something new on this program. So it is a pleasure, and we hope to have you on again.
You and me both. Thank you both.
We hope today's discussion has sparked your interest and curiosity in the future of healthcare IT. Remember, the conversation doesn't have to end here. You can continue to engage, learn, and discuss by following Health Data Movers on LinkedIn. Your support makes it possible for us to bring these vital conversations to you. If you're looking for the highest quality technology services in healthcare, or have questions about today's topics, don't hesitate to reach out at solutions@healthdatamovers.com. Whether you're part of the healthcare industry or simply passionate about the intersection of technology and health, if you enjoyed this episode, please follow Quick Hits on Spotify, Apple Podcast, iHeartRadio, or Amazon Music.